Okay, so this is part B, just a continuation of chapter 1 that we just finished, part A. Still on that. Okay, so let's talk about this. And I know we will discuss more of this in lab this afternoon. So we'll have a lot of this exposure already by later this afternoon. Once lab's done, we'll find out and get really solid on a lot of this stuff that we'll see in part B, right? So let's talk about this, right? We're kind of switching gears. This is 1.5 anatomical terms in the textbook. And we first start talking about the anatomical position. And so the anatomical position is defined as the body erect, which means they're standing up, feet slightly apart, palms facing forward, thumbs pointing away, is the standard anatomical position. Now, why do we do this? Why do we call this the anatomical position, and what's its purpose? Well, its purpose basically is to actually have a standard way of displaying the body, so that way we can study it, or students can study it, medical students can study it, scientists can study it, everything can study it. And so we have a standard. Because, for example, if I'm just talking about the palm, and the palm is in standard anatomical position, which means like this, thumbs facing out, as the definition says, right? Correct? And you're looking at my palm, let's say just my palm here, okay? That's a standard way of looking at it. So I can look at it from this angle, and if this doesn't move, I can look at it from this angle, and behind. Does that make sense? Now, if you were a scientist, and your standard anatomical position was this, and your standard anatomical position was, let's say, this, well then, this could be anterior for you, and that could be posterior for you. So you can see how it can get confused if we don't have a standard. And that's why we have a standard. We call that the anatomical position. Now, because of that, everything builds up on the standard anatomical position, right? And it's always assumed when you look at a figure, it's an anatomical position unless it indicates, okay, it's in another position, okay? Or when they write stuff, that's always considered assumed standard anatomical position unless they tell you otherwise. Directional terms describe a body structure in relationship to another body structure in the body, in standard anatomical position, of course. Okay? Right and left, we always use right and left, refer to the body being viewed on the right side or left side. Okay? And so what they mean by that is this is my right. Okay, so this would be the right side of the body. But when you look at it, let's say you're looking at my shoulder, this seems left to you. Okay? But it's always right to the model, figure, whatever's in anatomical position. So this would be the right shoulder, for example. Okay. So as I mentioned, here's table 1.1, and you're going to get some practice with this in lab. So I'm not going to go through these because you've got lab to go through them. So we'll save some time here. But these are standard directional terms. These are your main ones, right? And you'll notice that each of them, if you allow me to draw a line right through here, each of them have they're put up in pairs, and each of those pairs, they're opposites, right? For example, I'll take superior and inferior, the first one there. Superior is usually on top or above, and inferior is usually below, right? So those are opposites, top, bottom, in fact. And then you can see here, anterior, posterior, front side of the body versus the back side of the body. Those are opposites. And then you have these, medial and lateral, okay? But you also have one that we call intermediate, right? Between the medial and lateral. Lateral's on the outside of the body, medial's towards the middle, and somewhere in between is what we call the intermediate, just to show you what that means. And that's what those arrows indicate. And again, you'll get practice on it. So again, your major ones there. Okay, let's talk about regional terms. Two major divisions in the body, one called the axial, one called the appendicular. Now we use these especially in the skeletal system, but they can be used for when we talk about the entire body itself, not only just the skeletal system. So the axial is composed of the head, the neck, and the trunk. All right. And that's usually if you draw a straight line down the middle of the body, or a sagittal line down the middle of the body, mid-sagittal line. Anything you'll hit is usually axial. Anything outside of the line is usually appendicular, like the limbs. The leg and everything composed of the leg and the arms are usually appendicular. Now, within those divisions, we can subdivide and we can name places or sections of the division where you have certain things. And that's why we call these regional terms. You're going to be responsible for knowing all of these regional terms in lab. So we will discuss those in lab and you'll practice on those in lab. This will be part of your lab exam to identify these regional terms. Okay? Practice makes perfect. So again, it looks like an exhaustive amount of information here. And that's not just all of it. There's the backside of it. It is a lot of information. But when you practice them, I promise you, you start to get them really easily. And it becomes just behavior. Okay? I promise you. And that's what the lab's going to be. So I want you to practice through these. And you're going to get into groups and talk about this and point them out and, you know, use models of what have you. Okay? So we use another technique, I would say, that we call body planes to actually divide the body when we study it, basically. Okay, we call these body planes. And so these body planes divide the body in certain ways. There's three main kinds: sagittal, frontal, and transverse, all three of which you're going to get exposure to in lab. I'll have a kidney cut in these three different ways, and you'll identify in your group which one is which. And that helps you to understand how these work. Okay? And let me just, these talk about each, but I want to look at this one. This one's also in your lab book. It's also in your lecture book as well. But here's your three main planes. If you'll notice that the body is in anatomical position, although it's not the body's not looking straight at the screen, right? So kind of like in an angle. The reason why they want to look at an angle so you can see somehow like the plane like this one. I'm sorry, the plane like this one, and see how it's cut in a different angle, right? But look at the person; they're in an anatomical position, and if there is a plane that goes this way, okay, can cut the body into the right and left side of the body. Can everybody see that? That the sagittal plane basically cuts the body into a left and a right. Okay, that's the first one there. This one is a frontal, so it goes sideways. So if my hand was the plane, it would go sideways. And it cuts the body into the front and back. Does that make sense? Front and back. So again, we're cutting, imagining ourselves cutting the body in these two main pieces so we could study it better. And the transverse is right through the center, okay, of the body. And it's going to cut the body into a top and bottom. And that's the easiest way to learn those, right? Learn the name, where it cuts it, and it cuts it into the two sides. If it's top, bottom, left, right, front, back, then you know the three main planes. Pretty easy to do that. And in fact, a machine like an MRI actually cuts with chemistry, with electrons, cuts sections and takes pictures of these sections and then adds all those sections up together so you can see these pictures here, right? So you can do it this way, you can do it this way, or you can do it this way, right? Like this. And that's how you can see all of the internal organs, okay? So they shoot electrons through your body. There's a magnet, a big old magnet around you, and it collects the electrons. So when they collect, they whatever they touch, wherever they go, forms an image. And as they put all those together, like many slices of a book, and when they put it all together, this becomes the image that you see there. That's how an MR machine works. MRI machine works.
Is that why it sounds like a freaking train?
Huh?
Is that why it sounds like a train?
Yes, it's the magnet and the electrons firing, right? And the reason why you have to stay there a while is because they have to cut each. I'm talking about there's hundreds and hundreds of sheets, like a book this big, and each sheet represents a slice of a picture. When they put the slices together, it becomes the whole picture. So it takes a while for the machine to cut, picture, and then put them together as you're sitting there in that tube, if you will. The tube around it is the magnet. And it's actually the firing mechanism too. So it's firing and collecting on one side, firing, and that's how it's doing it.
I had one on my brain, so it was like, I think it was so loud, it was just so loud.
Yeah.
It was so loud.
Yeah. They're trying to figure out how to minimize the loudness of it, but that's just, for right now, that's how it is. Yeah. So our technology gets a little bit better. Yeah, for sure. The dorsal body cavity is the one that we use to protect the nervous system. So it's composed of two subsets, and we call those the cranial and the vertebral cavity. Okay? Or the skull and then the backbone, right? And again, we use the word cavity, but these are empty spaces that are filled up with. Okay? Here we're looking at the dorsal body cavity. And anything in yellow here is the dorsal body cavity. Here's the cranial cavity. You see it's filled up with the brain. Even though some students complain there's nothing sticks in there, there's nothing in there, there's something in there, I promise you. Okay, it's going to work just fine for you this semester. Okay, so there's that, and then this right here. And in fact, if you look at the spinal cord, there's a hole, an empty hole with all of the vertebral bones put together, and that's where the spinal cord will be. Okay. The ventral body cavity is the one in front. You can see that there. So there's two views. There's an anterior view and then the lateral view, the side view. And you can see the ventral body cavity has other subdivided cavities, right? But anything in red, anything you see in red is all ventral. And that's usually the front side. If I cut this, if this was a frontal plane, right, and I divide the body into the front and the back, right? Just using that, practicing that plane. Anything in the frontal is all ventral, or we call that ventral. And that's your thoracic cavity, your abdominal cavity, and your pelvic cavity. Here are the two cavities there. Now, inside of each of those cavities, we're having other cavities as well. All right? So how's the best way to study this, right? Flow charts are really nice to study. I'm going to create one for you here, a really small one. Everybody see the flow chart I just created there? Right? That flow chart I created, and I haven't completed it yet. There's still more to fill in. I'm just running out of space. I just can't fill it. But you see how I'm kind of organizing it there? This is really nice to put down as a way to study this, to learn it, right, if you will. you could go through the PowerPoint and just read the definition and read the definition and go to the side and read the definition and read the definition, or put it on a flashcard, or you can kind of draw it out this way, right? Body cavity, we know that there's two main ones. There's the dorsal, there's the ventral. And in the ventral, we've got the thoracic and the abdominal cavity. And in the thoracic, I would continue on and say there is actually, what, 3 cavities that you can see here on the slide? And I would fill those in, right? Right? And I continue on as far as it, and I would get all the cavities in here, and then I would say, oh, this is how it's kind of broken down. Everybody see that? We call this a flow chart, sometimes called a concept map, but this is a way to kind of change the way you're studying for this, right? Does that make sense to you? Instead of looking at all the words and say, oh, pericardial now, where the hell this is this, and all this stuff, this helps out. Okay. So I want you to, again, let's break up into groups there, 3 to 4 minutes. I want you, okay. So let's talk about this clinical really quick. All right. So you read the clinical. What does this really mean to you? What can you explain what's going on here? And why are we introducing this right now? Who's got the answer? Who can tell me kind of what's going on? Clarify, like what is going?
Like in this case, the stomach's going into the thorax. The cavity.
Yeah.
Could affect the organs.
True. Okay. So it's a tissue and organ that falls through from one cavity where it's supposed to be to another cavity. That's basically what we're seeing here, right? And that can happen. I don't want to say it's quite common, but it is somewhat frequent for folks to have this, right? And so I want you to also tell me if this happens somewhere else beside the 2 examples that they give you there. We got a hiatal hernia, right?
It can happen anywhere. Okay.
Well, give me an example where you would see this.
So no one can have to.
In the abdominal and pelvic cavity.
Yeah,
Okay. So how does this, or what happens with this? Pregnancy can actually, this can occur? Yeah, good. You probably, did you have this, or is this, did you know of this? Like,
Well, I've had several kids and I'm pregnant now, so.
okay, yeah. So that's like in your mind right now?
Yeah.
Yeah. Yes, absolutely. Yeah.
Tissues, everything everywhere.
Yeah. There can be abdominal hernias, right?
Yes.
There can be pelvic hernias. There can be situations where sometimes the abdominal wall is weakened and can cause, for example, your large intestine, but more than likely your small intestine to fall through the muscle lining and into your pelvic cavity. And can actually pinch off your small and large intestine, right? Can happen there. It can sometimes fall into your reproductive tract, not inside of the tract itself, but into the area where the reproductive tract would be. So we have that situation as well occurring. Yeah. Good. Viscera, we call this viscera, and the parietal serosa, and those are the okay. Now these are specific ones really special ones, cavities within the ventral body cavities, okay? The subdivisions that when I drew that flow chart, that's where I needed to extend it a little bit more, but I want you to extend it as you're studying, right? The pericardium is the cavity where we have the heart, holds the heart. The pleura is the cavity that holds the lungs. And the perineum is where you have the abdominal pelvic cavity. That's where you hold right here. So it's got its 2 layers as well. And so we see this gap right in between that has serous fluid as well. So along with the ventral body cavities and its serosa, you've got other cavities and their own membranes, as Jennifer and I were discussing, right? And this is just an example of the heart having its own double membrane system. Now, it's not 2 membranes like this. It's actually 2 membranes folded on themselves. So what you're looking at the very top is helping students to understand that it's much like a balloon. So if you took a water balloon and you didn't fill it up all the way and you put your fist through it, and you'll see that there's going to be the outside balloon, and where you put the fist, where the rubber kind of folds in, that's the other layer. That's kind of how this fills in. It's kind of like a bag that covers everything and seals the heart up. And you'll notice that it's not completely closed, right? There's an opening up here. Can you see the opening of the bag, if you will? Because you've got to have all of these vessels come in and out, because there's vessels that go this way, that way, and up the neck. They're kind of going like this, and there's one main one that goes here. This goes out there. So there's a lot of vessels there. Got to go out of so the membrane can't cover those. I mean, can't cut them off. So that's why there's an opening there. Let's get through these quadrants really quick, right? There's when we look at the abdominal pelvic region, right, or the abdominal pelvic cavity, if you will, which occupies the abdominal cavity and the pelvic cavity together, we call that abdominal pelvic cavity. We know that there is a lot of organs in the abdominal and the pelvic cavity, and because of that, we have to then create this way of looking at it or sectioning it off when we apply it in medicine, right? And we first do this with using quadrants, and quadrants basically means quarters, or dividing it into 4 sections, the abdominal pelvic cavity. And these are your quadrants here, right? Obviously, that's in anatomical position, right? Remember, it's opposite, right? And that's what you see there. This is our way of dividing it into major, and that's what you see here, right? What I drew is what you see there. It's kind of like a crosshair divided into quarters, and lo and behold, if you put it on the body, the quadrants will divide somewhat organs from each other, right? Where you would find most of your liver, which is kind of this dark brown stuff, would be right there in the right upper quadrant. Makes sense? Right up here. All right. Most of the rest of your liver, because it's continuous, it's not a section like that. You see it kind of right here. Everybody see that? That's the rest of your liver, but the majority of it, most of it, is on the right upper. Okay? I'll erase that. Look at your stomach. This is your stomach here. There's the stomach. And most of it falls in the left upper quadrant. But some of it, the tip of it, in fact, and the end of the stomach and the beginning of the small intestine are in the right upper right here. Okay? Now I want you to notice something as well. You see this little green thing? That's your gallbladder. Gallbladder falls in the right upper quadrant. So point being is that you start to identify where these organs fall in these quadrants, right? Now, we can take the 4 and we can subdivide it even more into basically a tic-tac-toe grid, like this, and place it right over exactly where we were at in the body, and we can subdivide it into what we call the abdominal pelvic regions. So it's 9 regions, obviously, okay? In fact, there it is there, and there it is there, right? Again, as clinicians later on, more than likely, the vast majority of your patients won't come like that, right? Nor can you look at patients like that. You can't. It doesn't work that way. You don't splay them open, let's go to surgery and let me see what's going on. Normally, this is what you're going to have to do, right? You're going to palpate the patient. You're going to examine the patient looking like this, right? All right, so you got to touch, feel, push, tap, whatever the case may be, to identify if there's any underlying issues with any of these organs. And that's why we identify these regions. And those regions are right on the gentleman there, okay? There are other body cavities out there. I won't discuss these here right now, but you'll see that there's other ones as well, okay? Some of them being part of the skeletal system, some of them being part of your